So in South Warwickshire, we've redesigned our emergency assessment unit to take account of changes that we've made over the last few years. That opens in 2 weeks' time. In Wye Valley, we've been looking at staffing out of hours and at night time, particularly to ensure that we've got the right staffing to meet demand. And both trusts have been really focused on staff flu vaccination with really high levels.
So for our mental health patients and service users, making sure that their care plans are fit for purpose to see them through the winter. For our acute services, making sure that our liaison mental health services support them properly to manage their demand, and that our community health services do the same by making sure that we prevent unnecessary admissions and facilitate quick discharge.
So we've created something called a ward liaison officer role, and those are people who work on each of the wards to support the nursing staff. Takes away some of the administrative roles, chases up the scans, makes sure we've got the pharmacy in place, and that means the nurses are then free to look after the patients on the wards.
Ambulance service has been working with relentless determination throughout this whole year to prepare for this winter, and a couple of really practical examples by putting extra paramedics, nurses and GPs into our call centres to be able to deal with more patients over the telephone, thus reducing the number of patients being conveyed to hospital, but also for those patients that do require to be taken to hospital by supporting the handover process with our acute colleagues by enabling us to free up our ambulances more promptly to respond to further emergency cases in the community.